Member North Vancouver Seymour.
Thank you very much, Chair, and thank you to the Minister. I just have one question. It's a question that I've actually asked a few times previously to many of the ministries that are connected to mental health and addictions. And this one is with regards to privacy laws. One of the major barriers that has always comes up with regards to communication between ministries, between jurisdictions, is the lack of communication and consistency of communication between, say, the Ministry of Health or the Minister of Children and Families, etc. Doctors trying to communicate with psychiatrists or psychologists or nurses or social workers and all of these sorts of things. What this lack of communication does is it essentially re-victimizes children and youth and families because they have to keep telling the story over and over and over again. So one of the recommendations that was brought forward in the Select Standing Committee for Children and Youth, that special project that we did, the 2-year project, the bipartisan report that we published on mental health, was to develop a system that apparently has been successfully implemented in New Brunswick, and it is a way of changing the privacy laws such that the communication can happen between ministries so that these children and family and youth are not constantly re-victimized. So my question has been directed from many of these other ministers that I've been involved with in estimates. My question has now been directed to you, the Minister of Citizen Services, as to whether or not this government would be considering changing the privacy laws to allow for communication, seamless communication, to help with the seamless delivery of mental health and addiction services in British Columbia.
Minister.
Through you, Chair, to my colleague across the way, thank you for that question. Having been a teacher all my life and a high school counsellor and done a lot of work in the area of mental health and vulnerable children, I think all of us realise that sometimes the barriers that get in the way are perceived, sometimes they're real, but that communication is really critical. And the current state of things with the opioid crisis and everything we're experiencing right now actually drives home the need for collaboration and to work together. And I think there isn't anybody in this House, doesn't matter where we sit, that doesn't realize the utmost importance that vulnerable children are protected, that any actual or perceived barriers to information sharing are addressed to ensure that these children are receiving the care and resources they need. The Freedom of Information and Protection or Privacy Act contains provisions actually right now that allow for information sharing where an individual's health or safety is affected. So sometimes there's the perceived, sometimes there's the real, but right in FOIPA, there already is a provisions that allow for information sharing where an individual's health or safety is protected. It also allows, Chair, for integrated services and for the broad sharing of information across ministries, and even with broader public sector, federal and private or non-profit sector agencies where it is necessary and appropriate. Having said this, we will work with our colleagues across ministries to examine this matter closely to ensure that there are no perceived barriers to this type of information sharing, because we know how critical it is for the well-being of our kids.
Member.
Thank you, Chair. So I'll give an example that was brought up in the committee, is that there was a psychiatrist that was seeing a child, and they had an outside office, and then also were seeing the child in the hospital. That psychiatrist in their office could not access his own files related to that child when he went to see that child in the hospital. So this is not just a perceived issue, it's an actual issue. And it was one of the major issues that came up that prevented collaboration and cooperation between sectors, and that was within the healthcare system. So what I worry about is the education system, obviously MCFD, the health system, and others. So I know that if there is a provision in there, certainly nobody's using it. So I guess what my question is if in fact this barrier is actually real, will there be a concerted effort from this government to prevent those barriers and this cross stoppage of communication that negatively affects the health and well-being, the mental health and well-being of children and families in this province?
Minister.
Thank you, Chair, and through you to my colleague. It's very difficult sitting here now to address a specific case that you talk about, that you have shared with us today. But just so you know that right now we are in the process of consultations on the Freedom of Information and Privacy and Protection Act. And we are looking at all of these issues. And I think it's also made us aware that we already have provisions, and we need to do an education process around what is there already. But absolutely we want to mitigate against any barriers that would prevent help getting to those who are most vulnerable.